Hello, everybody. Hi, this is Dr. Andrews. I wanted to share a little bit with you of my experience with our patient, Glenda. She had been referred to me from another doctor in the area for dry eye disease. And basically, through our assessments with her dry eye, we were able to work her up and ultimately discover that she does indeed have Sjogren's disease. And we got her in with rheumatology, got her some oral medications to help get her Sjogren's under control through rheumatology. However, the eyes were still very intensely dry. At the time she came to see me, she was not legal to drive with the vision that she had, so she always had to have a driver to come in. Her eyes were that dry that she couldn't even see to drive a car, which meant she couldn't work. She couldn't do her computer work. It was just very debilitating overall, and her eyes totally changed her life. I mean, she was in a very bad place, and ultimately we did a number of therapies with her. We did medicines such as restasis. We did punctal occlusion to help increase her tear production, and ultimately we were able to get her in something called a scleral contact lens. Scleral contact lenses are a godsend for a lot of Sjogren's patients, and this actually changed her life. So she has a little bit to tell us about how her experience was with the scleral lenses, and for any of you Sjogren's patients who are out there suffering, and come check us out, see if we can help you, or ask your local doctor if they can do anything, because scleral lenses are an awesome technology for the right person. And let's go touch in with Glenda and see how she's doing. Okay, I'm here with Miss Riley. She's one of our dry eye patients. She had come to me through a referral for extremely dry eye. The first time that I saw her, she couldn't even drive in. Say hello.
Hello.
The first time she drove in, or she couldn't even drive in to see us because her vision was that poor from dry eye. We ended up diagnosing Sjogren's disease, which is a disease that the body attacks mucus secreting glands and tear secreting glands and salivary glands. So basically, her body attacked her salivary glands in the mouth, and also the lacrimal gland, which is up underneath each eyebrow, under the eyelids, that makes tears. So her eyes were incredibly dry, and because of that dryness, she was not able to see. So she is also very nearsighted, and so this presented a really big challenge. She couldn't even drive her vehicles around. So we ended up doing a number of treatments, stepwise therapy. Each treatment got a little bit better. Ultimately, we wound up in something called scleral contact lenses. And scleral contact lenses are basically a very large diameter lens, so about the size of a quarter, and you fill the lens up with a fluid, and then you suck it onto the eye. And what this does is it helps to create a new barrier, so wind and different environments like heat doesn't evaporate the tear film. And so Glenda's here with us with a 6-month follow-up. And Glenda, how do you feel with the contacts in? I mean, do they feel like you're wearing contacts, or what do they feel like on your eye?
Oh, it feels incredible. I do not feel anything. I forget I have them on. It's time for bed, and I forget to take them off sometimes.
Okay.
No, it's
all right.
Awesome.
How many hours a day would you say that you're wearing these contact lenses on average?
Average over 8 hours, and sometimes up to 15, 16
Okay.
hours.
And mainly these contact lenses we're using as a treatment for dry eye. Have you went a day or two without wearing them? And if so, how did that go?
I had gone a couple days without them, and it is totally different from glasses to the contacts. And with the dry eye at nighttime, I saw a difference. So wearing the scleros was an improvement.
An improvement, okay. And before we had you on treatments like restasis, we did punctal plugs as a treatment for dryness. And are you doing any more restasis, or do you feel the need to use medicines for dry eye anymore?
No more medicines for dry eye. The scleros seem to take care of everything and make the eye feel so much moister.
Awesome. And what would you say to anybody out there suffering from Sjogren's disease who maybe has not had the chance to contact a dry eye specialist and talk about sclerals? What would you say to them to encourage them to check it out?
Oh, it's definitely worth the effort. It's patience, and you go through the steps, and it's the end product is amazing.
Is amazing.
If you can wear the scleros, it is well worth the
Awesome.
entire process.
Well, thanks, Glenda. Thank you. All right, everybody. So yeah, you got to hear from Glenda, and again, she's a positive testament to working hard and staying in the system and not giving up. Scleral lenses aren't for everybody, but she tremendously was dedicated to working to making it work, and she was dedicated to getting her Sjogrens under great control, which we have her there now. And I'm very happy for Glenda and her outcome and how things went for her. And if you're out there suffering from Sjogren's disease, come see us and we'd be happy to help you. All right, everybody, well, take care and thanks for watching, and I hope you have a great rest of your day.